24.3%. That is the average rate hike that Blue Cross Blue Shield of North Carolina says it will impose for 2017 on North Carolinians who buy an Obamacare insurance plan through the company. Now, the sticker shock reflects what's happening across the country as the Obamacare bad news just keeps on coming. Katherine Restrepo is the John Locke Foundation's Director of Healthcare Policy. She joins us now with the latest on Obamacare. Katherine, welcome back to the program.
Thank you.
So this Blue Cross Blue Shield rate hike is really staggering, and doesn't it actually follow another staggering hike from last year?
Yes. I mean, the AP and the White House just reported, well, since yesterday, that the average benchmark plans, or the second lowest cost silver plans on these exchanges, which really, those are the plans that determine how much someone receives as a subsidy based on their income. So those benchmark plans, on average, they're increasing by 25%. And that's a big deal because in the past years, while we've seen overall average increases of double digits, those have typically been lower. Employer plans are also really in the single-digit increases. But when we look at the individual market, it's this recurring theme that's happening, that these double-digit premium increases are happening. People are being stuck with higher out-of-pocket expenses in addition to much higher premiums. And that's not the way health insurances should be structured. I mean, there's nothing wrong with high-deductible health plans, which are what a majority of the plans are in the exchanges now, but typically they come with lower premiums. So there needs to be a better restructuring of the exchanges for this to be a sustainable market at all.
And of course, the irony from those who believe that there's a better way other than the government program called Obamacare is that its real name is the Affordable Care Act.
Yes.
So that's a little bit sadly ironic and frustrating for sure.
Absolutely.
Tell us, here in North Carolina, about how many people are going to be affected by this rate increase?
Well, really, so the White House is trying to sort of just tone down the situation by saying these are the underlying premium increases. So this isn't when subsidies are factored in.
They say that's kind of like if you buy something off the rack, that's not really the price that someone's going to pay.
Right.
Because some people will have subsidies that will lower that cost.
Exactly. So depending on your income, you can qualify for a subsidy that offsets the cost of your premium, and in some cases it can even offset the cost of your out-of-pocket payments, like your co-insurance or even towards your deductible. So that really is dependent on your income. So for if you think about it, for an individual making around $25,000 a year who doesn't have health insurance through their job, and they access and they purchase a health insurance plan on the exchanges, they really do benefit. They're really not paying a lot out of pocket, and their monthly premium is heavily, heavily subsidized. But for the rest of the exchange population, anybody really making above $30,000, when you're just looking at the individual level, and I'm just saying individuals because I've been looking up on healthcare.gov ever since yesterday or 2 days ago, people can sort of look around and compare prices and out-of-pocket sharing with what their plan may cost when they sign up for 2017. But it's really unaffordable. I even with subsidies, it's really not affordable for a lot of people. So I feel like when the media says, well, 90% of people in North Carolina qualify for financial assistance, I think that a lot of people are sort of lost in the mix there because that's such a blanket statement to say that health insurance is affordable for those 90%.
This is happening across the country, is it not?
Yes, it's not just a problem in North Carolina. This is a problem nationwide. I mean, I think in Oklahoma you're seeing an average 66% rate increases. In New Mexico it's like 100%. I mean, it's insane.
What has gone wrong? Because the promise of the Affordable Care Act, Obamacare, was that this would cost us all less money, we'd be receiving more and better care, and everything was going to be great as soon as the government got involved and put in place the mandate that we all have to buy an insurance policy or face a penalty. So why hasn't that happened?
Right. Well, there are so many overlapping variables that have contributed to this mess. I mean, it really is a death spiral in the works. You have really, for these exchanges to be sustainable, the Obama administration predicted from the get-go before these exchanges opened for enrollment for the first time in 2014 of January, that about 40% of the enrollees had to be the young invincible population, or the young, healthy, low users of the healthcare system, to offset the risk that insurance companies had to take on for the first time, the higher risk, because they couldn't deny anybody with a pre-existing health condition. So that's a problem. In North Carolina, we're only seeing, and nationwide, we're only seeing about a quarter of enrollees in that young invincible age band between 18 and 34-year-olds. Who are actually signing up for these plans.
So the estimate was that in order for this to be sustainable, 40% was the level of the so-called young invincibles.
Yes.
They're going to pay, but they're not going to use very many services.
And there's I mean, so many other factors. For example, all of these special enrollment periods, people are being able to game the system by signing up for health insurance. It's like this pent-up demand for healthcare in some cases, because in fairness, it's very difficult in the past for people with pre-existing health and conditions if they're priced out of the insurance market. I mean, that's a serious issue, but I think that could have been handled a lot differently to find more feasible solutions and sustainable solutions to fix that problem.
In fact, wasn't that actually happening here in North Carolina before Obamacare?
Yes, a lot of states had their own federally funded and state-funded high-risk pools for people with severe chronic illnesses. And I mean, of course, there's going to be holes in any system, but for the most part, it was working fairly well. Now, going back to the other factors that are contributing to the unsustained, like the volatility of this market. So you have the young invincible signing up, but then with going back to the special enrollment period, people are able to sign up at different points of the year, not just during their enrollment period window. They're able to use healthcare services for 3 months at a time, not pay their premiums, and drop their plan, and then the insurance providers and the doctors are on the hook for those expenses that have been incurred.
That just defies common sense, that you can use the service and just refuse to pay?
Yes.
Does anything happen to you?
No, there's a 3-month grace period where enrollees are allowed to do that without and they're not hit with the individual mandate fine, the penalty for not having health insurance.
These younger people, healthier people who are not signing up at the levels that the system really requires for this to have any chance of working, what are they doing? Are they just paying this penalty?
I really don't know the actual estimates or the numbers on that, or the different age groups of people opting out and just willing to pay the penalty and forego health insurance. I'm really not sure, but I do know that it's just, I think that young, healthy people who don't have insurance through their job would be much more attractive to plans if you have a high deductible, but have a lower premium that's affordable. I mean, I was just looking today on healthcare.gov, and a 26-year-old starting out making $30,000 a year, male, he would qualify for a subsidy, but on net, his premium would still be around $122 a month for a catastrophic plan with, I think, a $6,000 or $7,000 deductible. So, lower your premium, and if you're still willing to pay that deductible, that's what an insurance policy ought to look like.
Katherine, I can't leave this segment without asking you just to briefly explain what you said a few moments ago, which was this is a death spiral in the works.
Yes. In other words, the medical claims that are being incurred are completely outpacing revenue from the premiums that are coming in. And this is why Blue Cross and Blue Shield and other insurance companies are losing hundreds of million dollars on just a sliver of their market share. And that market share is the non-group market.
And that's where Obamacare stands as of this sign-up period right now. We've been talking with Katherine Restrepo. She is the Director of Healthcare Policy for the John Locke Foundation. She's been writing a lot about this issue. You can find it at johnlocke.org and carolinajournal.com. Katherine, thank you.
Thank you.